Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
It's clear now, but the local forecasters have their sights set on a storm that could bring the first big snow of the season.
And they're playing for a whole lot more than just oranges. The Wolverines make their final preparations ahead of tomorrow's semifinal matchup at the Orange Bowl in Miami.
But we're going to begin here at 5 with multiple new developments in the battle against COVID-19 here in Michigan as new cases hit record levels. And the first new development is big for children and their parents.
Yeah, it certainly is. The FDA is expected to expand eligibility of the COVID booster shots to kids ages 12 to 15. And that decision is expected to happen within the coming days. This falls in line with what the director of the U.S. Centers for Disease Control and Prevention said on Wednesday. And teens who are at least 16 years of age already have access to booster shots.
And right now, getting a booster shot is as easy as it's ever been, but the same can't be said for getting a COVID test.
No, it's completely opposite. It's so tough right now. And this week, we have seen people waiting in line sometimes for hours to get the PCR tests. And good luck finding those at-home rapid tests right now. Meantime, in other states, getting tested is actually a breeze, we found out. Grant Herms has a look at how Michigan could learn a little something from our neighbors to the south.
At-home rapid tests like these have become worth more than their weight in gold and even harder to find than the precious metal. But in other states, they're readily available. So it begs the question, why can't Michigan do the same?
As Michiganders spend hours searching for testing sites and wait for hours in long lines, rapid tests don't feel so rapid. But in other states, there's hardly a wait at all.
So far, 7 states and Washington, D.C. have put rapid tests in libraries and other public places. In Connecticut, the governor there announcing the state would be sending out 3 million tests and nearly 6 million masks. Across the border here in Ohio, they have one of those library programs. According to this state's Department of Health, they've given out more than 4.8 million of those take-home tests, more than all of Michigan's tests combined. At this library here in Toledo, they are completely out. A librarian telling me today what used to last them 1 to 3 days in testing supplies now lasts just 2 hours. But they say that's the point. They want to get more tests in more hands, and they know that people are coming across the border from Michigan to get those tests.
Michigan does not have a statewide program for at-home tests. The closest thing is a pilot program sending tests home with students and staff from just 3 school districts, which so far account for just 120,000 tests. But none of those tests have been universally available to the public or sent directly to homes. When asked today, a spokesperson for Governor Gretchen Whitmer declined to say whether the state had a plan in the works to make tests more broadly available. Instead, pointed to a new federal plan to distribute 500 million tests nationwide, saying Michigan would likely get millions of those tests. But when those tests could arrive is unclear, meaning getting a rapid test in Michigan is still a waiting game. In Toledo, Grant Herms, Local 4.
All right, Grant, thank you. The state also says that it has sent hundreds of thousands of tests to schools, nursing homes, correction facilities. It also has a website for you to find a test if you're looking for one. We're going to post that link on our website at clickondetroit.com. Now we turn to COVID testing, from COVID testing to treating COVID and what's happening in hospitals all across the region. They are struggling right now to keep up with the surge.
Very tough. And when you look at the 7-day moving average, that surge is not expected to slow down anytime soon. Let's get to Nick Monticelli, who's live tonight at Henry Ford Macomb, where things continue to be very difficult for healthcare workers. Nick.
It is a struggle, Jason. When you talk to the doctors and nurses that are working inside of these hospitals, all of them tell me that it is just difficult and heartbreaking to watch patients line up trying to get taken care of, and some waiting to get into the ICUs, and they say it is only going to get worse.
There are a lot of patients on ventilators.
This is a first-hand look inside Metro Detroit hospitals and yet another COVID-19 surge. Dr. Jana Gardner-Gray at Henry Ford Health shows us around, pointing out patients that need to be placed on ventilators to help them breathe as COVID-19 has overwhelmed their lungs.
This is one of our ICU patients that's been waiting for many hours for a bed in the ICU.
And full is an understatement. Maxed out is more accurate. Henry Ford Health says as of this morning, it had about 390 COVID patients, and they expect those numbers to go up in January. In terms of testing, Henry Ford said on December 20th, 24% of tests came back positive. Yesterday, that rate was at 40%. It's the same story at Beaumont. Dr. David Donaldson says it is disheartening seeing all the people that need help.
We are overwhelmed right now. The amount of COVID that are coming in really are displacing our ability to treat other patients that are coming in.
Another issue is another treatment option that's dwindling. Monoclonal antibodies can be given to help a patient fight off COVID and stay out of the hospital. But that supply is running low across the state, forcing hospitals to be more restrictive on who gets it.
The resources for actually getting the monoclonals are down, but also staff is down. We've got a lot of staff that are out with COVID currently, and that includes the infusion staff to administer that medication.
So I asked those doctors, okay, what can we do to help? How can the public help? And he said one of the number one things is to continue talking about vaccines. He says the number one misconception is people saying, well, wait a minute, I see people that are vaccinated in the hospital, so why would I get a vaccine right now? His answer to that is, yeah, there might be a couple, but the numbers are very low. And Jason, the alternative is, well, if you've got a vaccine and you might be hospitalized, okay, you're going to survive. The other ones that are unvaccinated, there's a much higher chance of them dying.
Exactly. And the other point you make when it comes to the public helping, I'm wondering what they're saying about, say you need to go to the ER or the hospital at the very least, and you don't have COVID, but you're not sure what you have. Are they asking you to maybe think about that for a minute?
Well, what they're saying is if it's an absolute emergency, yes, come into the ER. They'll take care of you. They'll get to you eventually, but there is going to be a longer wait.
Right.
But if it's not an absolute emergency, if you can talk to your primary care doctor, if you can do a virtual visit, please do that instead.
Yeah, exhaust those options first. Nick, thanks.
The CDC extends its travel warning for cruise ships to the highest level. The agency is warning the risk of catching COVID on a cruise ship is very high, regardless of your vaccination status. The CDC is currently investigating dozens of cruise ships that have had COVID outbreaks. About 5,000 COVID cases on cruises have been reported to the CDC between December 15th and the 29th.
All right, well, it may be just the calm before the storm, but it was relatively quiet out there today.
Yeah, it was pretty quiet today, but all highs, of course, are on the weekend. Paul has been tracking what could happen around here. Is it becoming more clear now, Paul?
Yeah, a little bit more. We still have some differences to work out. And by the way, in our Skycam shot, look carefully. You see an upbound freighter here, live shot here from our Windsor Skycam looking across the river at our beautiful skyline. 35 right now in Detroit. We have 33 at Howell, Pontiac, and Adrian. And as you can see, the wind is very light, but an easterly direction. So we're seeing temperatures a little warmer near the water than farther inland. So farther inland, it's more like 33 degrees. Near the water, 35, 36 degrees or so. All right, you see all the cloud cover here. There's just lots of it. We haven't had much sunshine this week, but we're going to maybe get a crack of it tomorrow. We'll see. But for this evening, the important thing is going to remain dry. And we're going to have a lot of cloud cover around, but the clouds act like a blanket. So when you have that blanket, the temperatures don't fall as much. So we're just going to fall maybe a degree or so through the evening hours. And keep in mind, this is our average high for the day, and we're going to keep this all the way through midnight. So once again, above average temperatures. So coming up, again, we're talking about that storm, but we also have to talk about New Year's Eve. It looked dry all week long, but right now, the high-resolution models are trying to introduce a chance for a little shower in there, so we'll talk about that. Saturday, it's going to probably start as rain, change to snow, and then Saturday night, I think for most of us, it's going to be the biggest snow of the season. Here's just a sneak peek of the computer model for 7 p.m. Saturday. Again, starting off as some rain earlier in the day, but this line is going to just kind of peel southward as we move through the day. So we'll talk about that. We'll show you this in great detail, again, coming up in just a few minutes, guys.
All right, we look forward to it. Thank you, Paul. Now to an update to a story that we brought you last night. A driver is dead after a crash on Belle Isle. Police are saying the 56-year-old man from East Point was speeding Wednesday night without his headlights on when he crashed right into a statue and the vehicle burst into flames. The driver was unresponsive when officers pulled him out of the car. They performed CPR. The investigation into the driver's condition before the crash is ongoing.
Right now, we're a little more than 24 hours away from kickoff at the Orange Bowl, and it's buzzing down in Miami, also probably about 80 degrees.
Yeah.
Ahead of the big game tomorrow night, where the winner gets a shot at the national championship. This is Michigan's first ever trip to the college football playoffs, as you know, making it clearly one of the biggest games in program history.
Absolutely. Jamie Edmonds is with us. And Jamie, yesterday we got a chance to hear from the players. Now it's the coaches' turn of how they're preparing, what their mindset is.
Yeah, that's right. It's Kirby Smart, it's Jim Harbaugh, and a joint Zoom session today talking to the media. There were light moments when they discussed sharing the same birthday, December 23rd, and more meaty moments when Harbaugh was asked the status of defensive back Daxton Hill. His answer, Hill is still questionable for Friday's game. When it comes to the week the team has had and finally suiting up against the Bulldogs tomorrow night, Harbaugh says the Wolverines will have to have their best game of the season, no doubt.
We're going to have to play good. It's going to be about that for us to have a chance to be successful, chance to win. We're going to have to play good and play right up there with our best. That's what it's going to take in this ball game.
Now, on the other side, Smart sort of said the same thing following the loss to Alabama in the SEC championship game. He says his Bulldogs will have to play physical. Much more coming up in sports, what Jim Harbaugh had to say about taking a pay cut before the season, plus the Spartans play in the Peach Bowl in a few short hours, sending it back to 2 Spartans.
They do?
Yes.
I had no idea.
We do. I see the green tie.
Sure, that's tonight. We've got the lucky tie. It's in the bank.
Let's go green.
Thanks, Jamie.
Thank you, Jamie.